Hello, everyone. Welcome to the Glen Alex Show. On the Glen Alex Show, we talk about the whole person because true health is more than diet and exercise. You are whole, and all of you matters. And I personally believe that healthy people are more available to give and receive genuine love. If everyone had their optimal level of health or were in pursuit of it, there would be less manipulation, less coercion, and yes, less violence in our world. So please join me on this path to total health. And with that said, please help me welcome my guest, Dr. James Wagner.
Thanks.
Thank you so much for being here. I know you have a pretty busy schedule, so I appreciate you taking time to visit with us today. So please introduce yourself.
Hi, I'm Dr. Jim Wagner, a local dentist. I'm originally from Lorain, Ohio. I grew up on a farm there, moved to Las Vegas in '97, and I've been practicing here ever since. And that's one side of my activity in life. And the other side that I've spent a lot of time is with yoga. I practice yoga 6 days a week, and I teach it a couple days a week.
Okay.
So we'll integrate some dental things and some yoga things. We'll talk from my experience and a bit from yours, perhaps.
You might get some yoga poses in while you're getting fillings. You never know.
Okay.
I have a quick story about Dr. Wagner, though. He actually is my dentist, and he's a fantastic dentist. About 3 years or so ago, I needed fillings done, so I scheduled an appointment. And before the appointment, I planned a sushi dinner afterwards. So when I walk in, I say, "Doctor, I'm eating sushi after. What can we do? Can we use less Novocaine or whatever the painkiller was?" And he said, "Well, let's try it without any painkiller." And I said, "Okay." And let me tell you, Dr. Wagner filled 3 fillings, and I had no pain, no residual, and I totally enjoyed my sushi dinner. Was so thankful to him for that, and I will never forget that because that was just absolutely awesome. So he is not only very personable, he's also very skilled. So, thank you.
Okay, you're welcome.
And
It's a good story.
It's a great story. And thinking of that story, do you improvise like that a lot in your practice?
I try to provide what people really want the best I can.
Okay.
So I listen to what people say and try to do it the best way we can. And fortunately, in many cases, we catch things early enough that we do not require anesthesia.
Okay.
There are things that get a little more involved, but a lot of things we can handle with just being gentle and being nice, I think.
That's always a good approach.
Yeah.
Can you think of another situation or story in which you improvised for a patient?
Oh, geez.
Just a quick one.
Oh, yes. Ask me a little more detail. Improvising. Okay. Last Thursday, which was my Friday of my work week,
Nice.
a wonderful lady came in who's been in my practice a long time, and she had a broken off tooth. It was an old crown broken off, and it's the kind of thing that, because of the way the root is, we're not going to be able to rebuild it. The tooth for her, we have to do an extraction in that area, but I couldn't do it that day on Thursday, so we rescheduled her, or hoped to reschedule her, at least when we were in the treatment room, for the following week, and she's going to be traveling.
Okay.
And all weekend long I was concerned about thinking of her traveling without that tooth there, and it bugged me, and we could not get a hold of her. We went to the office and got her phone number. I couldn't get a hold of her. Her phone system wasn't working. I was getting a signal. No matter what phone we called from, her phone wasn't picking up, and it bugged me. Anyway, I believe it was Tuesday morning, she called the office, my office, and we got her in. I was able to improvise something for her to fill that space so she didn't have to travel with a gap in there. That bugged me. So we improvised, and all weekend long I was saying, I can do something for her, at least to get her by to fill that space, and she smiled, and we did. So I improvised.
Well, that's a great story, and I'm pretty sure she appreciated it too. So now she has some comfort while she's traveling,
Sure.
And hopefully she can get in soon.
Yeah, I wouldn't want that. So that's improvising, I guess.
Okay. And what is the name of your practice?
Dental well-being.
And what's the story behind that name? Because we don't often think of well-being when it comes to dentistry.
That's part of the reason we should. And my thinking in that process, For many years, the name of my practice was dental artistry. I did a lot of work that was artistic, creative, cosmetic, as well as with implants and dentures and things, making it look good, making it natural. To me, that was artistic.
Okay.
It came time to move my office and downsize about 8 years ago, and I moved it and I renamed it Dental Wellbeing. I thought that suited more of what we provide, more than the artistry, but that's still there. But well-being, there's so much information these days, more than ever, on the connection of the health in our mouth with the rest of our body. I mean, it's all one body, but we tend to maybe think it's something else.
Right.
So part of my mission is to help people become healthy. So on the door of my office, it says Dental Wellbeing, Health, Comfort, Beauty. And kind of in that order.
Okay.
Health, comfort, and beauty.
Okay.
So.
Well, it's very difficult to be comfortable when you're in pain or.
Good point in life.
Right?
Try to travel.
Right, and you can't feel beautiful when you're run down.
Yeah.
Yeah. So, I like that. I like that a lot, and it also speaks to the incorporation of yoga into your life. You kind of bring a holistic approach to your practice. Is that what I'm hearing?
Yes.
Okay.
Yeah. We talk a lot in my office about a lot of things. I mean, patients come in. One of these days I won't be practicing dentistry. I mean, I've been practicing 38 years and I love it. I'm very good at it. I'll continue for the next 3 to 5 probably, something like that. One of my concerns or thoughts is that I won't have a daily opportunity essentially to meet people. I cross paths with people my whole life and my whole career. I've been able to do that in dentistry. Nice people. Get to know them. They become family by choice or friends or that sort of thing. And I wonder what I'll do when that happens. In the meantime, in order for me to be on my healthy path, one of the things that I've incorporated starting about 18 years ago is yoga. I was kind of in life researching what would be a good getting older kind of physical activity before I got older. I mean, for many years I thought golfing might do it, and they could, because I see people golfing that are, they're getting older and they still enjoy it, but I also see injuries.
Yes. I
don't see that in yoga. I mean, you can injure yourself in yoga, but it's turned out to be something that for me is a lifestyle, not something I go and do.
Not just an exercise.
Right.
Yeah.
And I've been practicing yoga. Ashtanga Vinyasa is the type.
Okay.
And I teach it also a couple days a week.
Okay.
And it's something that I just really, really love to do. And that then led to changes in how I eat, because you don't go to yoga right after eating a really big old...
French fries don't work with the down dog.
Yeah.
No. Okay. Well, that's all very fascinating, and we'll get into it a little bit more. But for now, we need to take a quick break. Please check out our sponsors' commercials, because I do like to eat and I have bills to pay. You can also take this opportunity to visit my website, livingintotalhealth.com, and order your copy of Living in Total Health. It will be signed before it ships. And if you're an Amazoner, it is available on Amazon Prime as well. We'll be right back.
Have you ever wondered what it would take to be healthy from head to toe? Not just on the outside, but inside as well? Glen Alex, author of the highly recognized book, Living in Total Health, will guide you to becoming totally healthy. Glen is a health coach, licensed clinical social worker, public speaker, educator, and humanitarian who has set the standard with her 25 years of experience in the health and wellness industry. Glen addresses the whole person to achieve optimal health. Glen's book, Living in Total Health, is not a how-to, but a why-to for a healthy life. Purchase her book through her website, livingintotalhealth.com, for an autographed copy. Or you can get a copy on Amazon, or an ebook version at smashwords.com. Those with a high level of health do not intentionally harm oneself or others. Make the world a better place and start living in total health. Visit livingintotalhealth.com today.
Welcome back to the Glen Alex Show. I am here with Dr. James Wagner, my dentist du jour. He is very skillful. Right. In the first segment, he introduced himself and talked a bit about his practice, Dental Wellbeing, which takes a more holistic approach towards patients rather than just focus on their teeth. And so I wanted to know, just so people will know, what types of dentistry do you practice? You mentioned the artistic part before, but are there other specific types that you work on?
Sure. I'm a general dentist, and over the years I've focused my attention in general dentistry to a couple of main areas.
Okay.
Early on, in the early 80s, there were no white materials, for example. So that was the beginning of cosmetic dentistry, when white materials came along, the white fillings or porcelains. We didn't have those things before that. And so early on I started looking into cosmetic dentistry, and I earned credentials in that, and I studied to learn and proved my work to the experts, and I've lectured and taught and things like that. And I really enjoy the cosmetic side of things. It's very gratifying and enjoyable. Another area that I started on in 1983, and for 20 years I placed dental implants in the bone and put teeth on them. One person doing the different phases because we didn't have surgeons.
Yeah, but that sounds horrific.
Well, yeah, the thought process may be not exciting. The end result is extraordinary. It's like having teeth again for people that need it. What I discovered at that time, because it was early with implants, people had not had them before that. And it was a godsend. There were people that were suffering, literally in pain, suffering, and needed help, and nothing was available. So I started learning, well, what can I do for these people rather than something, say, removable, which wouldn't work in their mouth. So I focused and learned a lot about that also.
Okay.
In the meantime, the underlying theme for me in practice has always been, what can we do to be healthy and comfortable and look nice? It all kind of ties together with health. So
it does.
That's dental well-being. That's what I provide now.
Okay.
And I have the background in the other things, so those get thrown in the mix. What I really truly enjoy doing is helping someone that even has basic, simple needs. Clean things up, help freshen up, teach people how to stay healthy and healthier. And I do these other things that help out with them as part of that whole process.
Do you do that during the appointment, or do you meet with them separately? How do you incorporate helping people get healthier into your dental work?
It's built into the practice. For example, I have a habit of talking with almost every single new patient that comes to my office for, 5-10 minutes, just talking about how they can stay healthy, how to brush, floss, rinse, things like that.
Okay.
I like to do that. I can tell them something useful they can go home with. They're better off for it. Plus I get to know people a little bit. We talk, we chit-chat.
Right.
I like that. So helping people get on the path to healthy. Sometimes will do a consultation. Sometimes on that appointment they're there for emergency. Other times, and mainly, they'll come in to be evaluated. We make some x-ray pictures, check things, models if we need them, photographs, analyze what people really want, what they need, and then make a plan as to how to prioritize that and do it. So it starts with an approach of how can we become healthy, and here's a person, what is your need? What can I really do? What's your main concern? If someone comes to me and they have a main concern, and no matter what we end up doing, if we don't address that main concern, we kind of miss
the boat.
Something.
Yes.
So I think it's important to find out what people want, what they need, and in the meantime, at that same time, I get to meet people.
Okay.
And that's a wonderful position to have in life, where you get to meet nice people and interact with them.
That's awesome. And I can actually attest to the personalized approach that Dr. Wagner and his staff takes. I was referred to him for a second opinion. There was a new dentist that I had, because my previous dentist had retired and this new dentist bought the practice. This new dentist insisted on crowns, and $800 a pop. And I said, no, I'm going to get a second opinion. I went and saw Dr. Wagner. He said, I don't know why you need these crowns. I can do this, and I can do that, and I can do that. And he did.
Did I say it like that?
No, that's the way I heard it. I don't know if he said it that way. But he does take a personalized approach, and he is very personable and humorous. I mean, you think of going to the dentist, most people will cringe. I remember going as a kid, the only reason why I wanted to go was to get a lollipop. And now when you go into Dr. Wagner's office, his staff is very warm. very welcoming, and the humor he uses while he's working on you is just, it's very relaxing, actually. So I do appreciate the approach you take to your practice. Thank you for that.
You're welcome.
Thank you.
Keep it enjoyable for me too.
So are there any other things that you do to help people be comfortable in a dental chair?
Yeah, there are other things. Some have to do with just getting along well and being heard. For example, if you're a patient, you want to be heard. That's kind of what we touched on. In addition, there are ways that we can, say, use some sedation, like nitrous oxide, laughing gas.
Okay.
That's really, really helpful for many people, and it's a very simple thing. I mean, it's like a low risk, low problem, very nice kind of a gentle thing to do for people that have apprehensions or are more sensitive. Some people you got a lot of nerve, I mean, you're stuck with it. Your nerves work more. You need something extra.
Okay.
So that helps with that, as well as one of the main concerns I think people have. There are a number of on the dental list. People, the least favorite,
Yes.
And just if you have to get numb, people don't. Some people mind being numb, but mostly it's the getting of the numb,
Right.
And I'm pretty good at doing that. Very, very, very gentle. And people will ask me, when you're going to get it numb? And I'll say, we already did. That's what I was just doing there. And that's helpful. In other words, I don't know, recognize what people's concerns are and try to be nice in dealing with it.
You mean you listen? You listen to people?
I enjoy that part of it.
That's awesome. I really honestly wish more doctors listened. I wish they did listen, so thank you for doing that. So can we use that gas on me next time?
Yep.
Instead of Novocaine or something?
Sometimes instead of, sometimes in addition to.
Well, if you could do fillings without the painkiller for me, maybe I'm just looking for the extra boost, the fun part of the gas.
Now, this is the kind of conversation I have. You'd be sitting there, and we're starting to negotiate now. What is it you would like? And there's
3 cc's? No kidding.
There are ways to do it.
Yes.
Usually, I mean, figure it out.
Okay. Oh, very cool.
Why
See?
not, right?
Right.
Go for it. You do it that way. I'll help you.
If you can do.
Yeah.
So quickly, tell people how they can contact you if they want to know more about you or your practice.
Oh. You could call the office. I'll give you that phone number.
Yes.
That's old school, isn't it? 702-648-1200. And I have a website, Dental Wellbeing LV. That stands for Las Vegas, or love, anyway.
.com?
.com.
Okay.
Well, I left you hanging there. You don't have to put that on the phone or anything anymore.
Well, sometimes because WCOBM is WCOBM.tv, so sometimes. All right.
Website, email me.
Thank you, doctor. Okay, so please stay tuned as we take another quick break. Check out my website, livingintotalhealth.com. Living in Total Health is also available on Amazon. And please feel free to contact Dr. Wagner if you have any questions or want to get in before he retires, which we're not going to let him. So we'll be right back.
Thanks.
I actually was able to get a copy of your book, and I couldn't put it down.
I'm here today with Glen Alex, the author of Living in Total Health. We're talking about health issues today. I'm a dentist and a yogi practitioner, and Glen has a couple questions for me. She said they might be surprise questions. So let the games begin.
Thank you, Dr. Wagner. Okay, so he was cutting up during the break. I'm still very tickled in Vegas about sleep dentistry. So could you address that?
Yes, sleep dentistry. It can refer to a number of different things. What we think of, if you see a billboard that says sleep dentistry provided, you think, you're going to go in there and probably have some kind of medication, and then you're going to doze off and you'll wake up and things were taken care of, and now you go home and you feel better. Usually you have a driver. They're all different levels of what's called sedation dentistry or sedation in dentistry. There are different levels of it. Another thing that you could think of is if you go to the hospital and have a surgery and there's general anesthesia and you're put to sleep and they have an anesthesiologist available and your heart and lung functions are being monitored and supported if you need it. So there's some extremes. Another type of sleep dentistry more commonly would be if you take a certain type of a pill. Usually they'll tell you what color the pill is on the billboard.
Red or blue?
Perhaps. And the idea with that is you're going to take some kind of medication, you're going to become very sleepy to the point where you might nod off, doze off maybe.
Okay.
It's harder to control because you took a pill and it has to go through your system and it takes time. So if you want to have a similar effect of sleep or sedation dentistry and it's more controlled and faster, you might start an IV because you can administer drugs faster, you can reverse them faster if you want. Now we're talking about a different level of care.
Yeah, right.
Some people cringe at the thought of even having that administered.
Yeah.
Other people don't care. They say, okay, go ahead and sedate me, Like, okay, and that's fine, but everybody has a different way of looking at it, a different choice, different option. You have to go to a center that's certified also in those kind of sedations.
Okay.
A very simple sedation would be nitrous oxide, which is the laughing gas. I was talking about it a little earlier.
Which is the one I want to try.
They call it laughing gas. It helps you feel better and more relaxed, and you actually feel less. If you haven't had laughing gas yet, it's worth trying sometime, just to see what the effect is on you. And it's you have a distant feeling, you get very relaxed, and you can have Novocaine for something or not have it, and then do some dentistry, and that's another type of sleep dentistry. So sometimes you combine them. You can have a pill plus the laughing gas.
Okay.
There are different ways
Sounds
to do
like
things depending on what you want.
Okay.
So if you see a sign that says sedation dentistry or sleep dentistry, you have to find out what kind that is and if that's for you.
Okay.
I do not offer the IV sedation. I used to do dental implant surgeries years ago for 20 years. I don't do that now, and I don't offer that type of sedation in my office. But we're real good at helping people relax, stay comfy, using some laughing gas, using some anesthesia. I'll even treat children, which I don't treat a whole lot of children because my rule is my patient has to want me to do what I'm doing. I don't care what they do.
And kids don't.
If it's a child, it doesn't matter what age, 3 or 6 years, and they really don't like what I'm going to be doing, I send them to the specialist for children.
Okay.
But a lot of children I still treat because we can do it and they're aware enough and they can make that decision, and I can provide what they need comfortably for them and me.
Okay. Well, let me interrupt you for a second because I do want to get to something that I feel is important for people to know. And as you all know, my perspective is total health, incorporating the mental, physical, spiritual, and emotional to achieve true health. And so what I want to know from you is, how does what's going on in the mouth indicate what's going on in the rest of the body?
Oh, strong connection. It's the same body, for example. And this is about one part of it you can look at, and you can tell a lot. When I first look at someone's mouth, their teeth and gums, I could tell a lot about the health of their mouth just by talking with them a little bit.
Okay.
When I see the health of the gums, then we have a pretty clear picture of what's going on everywhere else. Once they open and see what's going on, okay, then I have a good idea what's going on in the mouth. Something very similar is happening in the rest of the body.
Okay.
So,
for example?
If you have a diabetes, it affects the gum tissue. The connection is dramatic.
Okay.
There are inflammation, general body inflammation. You can see it in the size of tissues and appearance, in the tongue, in the cheeks, in the gums, the color. The most important area around in the mouth, around the teeth, is right where the gum line meets the tooth. Keep that healthy, and the rest of life will be a lot better off for you.
Okay.
Find out how to keep that area healthy. Right where the tooth comes out of the gum, right there.
Okay.
Focus your attention on there. Brushing, flossing, rinsing, electric brush, sonic care, hand brushing. It doesn't matter. Keep that area healthy. Find a way to do it. That's number one for everybody.
Okay.
Go somewhere and find out how to keep that area healthy, and the rest of your body will benefit from it.
Oh, that's awesome.
A lot of the bacteria we find in the gum tissue in the mouth travels. It gets everywhere else. It doesn't belong everywhere else. It gets in heart tissue, it gets in vascular tissue, lungs, different organs, the brain. There are all kinds of connections with bacteria in particular in the mouth and the rest of the body.
Okay. Oh, that's fascinating. So for people who don't like doctors, like medical doctors, for them to get an idea of what's going on in their body, should they come see a dentist first?
I wouldn't say first, but put it on
If
the
they
list
won't
for
go
sure.
to the doctor at all.
Start somewhere.
Start somewhere.
Please.
Yes, please start somewhere.
Yeah.
Okay,
Yeah.
That's fascinating, folks. So that's another reason to go and get your teeth checked out. You might not get a lollipop, but you'll get the information you need to meet your health goals. So thank you for that, Doctor. And thank you so much again for being here. Please tell everyone again how they can contact you.
Dr. Jim Wagner. I'm on Sahara near Buffalo. Phone number 702-648-1200. And I have a website under development at times. But dentalwellbeinglv.com.
Okay,
Thanks.
thank you. And please, again, let's thank Dr. Wagner for taking time to be here today. This was so much fun. The time did fly by, even though I was a spaz as usual. I do want to leave you with this one thought, though. Eleanor Roosevelt said, one's philosophy is not best expressed in words. It is expressed in the choices one makes. So I am here to implore you to make the choice to be healthy. Your choices don't matter. They are absolutely meaningless if you don't put the action behind them. If you don't put affirmative action, proactive action behind your choices, then you're actually making a different choice. So if you say you want to be healthy, yet you eat French fries every day, you know that's not good. If you say you want to start being on time so the people in your life are more respectful of you, yet you allow yourself to remain distracted and you're always late, then that's an issue as well. So as Eleanor said, the choices you make really define who you are, not what you say. And I personally pay more attention to people's behavior than their words. So put action behind your choices and you will start to meet the goals that you want. In the meantime, please join us for the next episode of the Glen Alex Show. In the meantime, be well.